On today's episode of Save My Piggies, I'm happy to have a guest, Steve, who has been dealing with peripheral arterial disease for quite some time. And today's focus is on the cornerstone of treatment, which is a walking program and being very aggressive but conservative and potentially avoiding surgery or procedure. So, Steve, welcome to the podcast. Thanks for spending some time with us. And why don't you tell us your PAD story?
Well, no, thanks for having me. My PAD story really starts out about 10 years ago. I was having severe pain in my lower calves, especially in airports when I was pulling a bag around, and also walking. I really would start having pain after just walking a couple blocks in my lower calves, and so I got a referral into a vascular surgeon, in this case at Kaiser, where my wife works, and we did an ankle bracelet test.
So you knew enough. You knew that this was a vascular issue. How did you know that?
I did. I really didn't. I got referred by my primary care physician, and I was experiencing pain at night too, in my lower calf and foot. That would wake me up. So I was having leg pain at night too, and that's really what eventually prompted me to try to figure out what was going on. And so we did that test, and then we did a test. I think angiogram, of my lower extremities. And my wife actually was a CT tech, as well as had managed X-ray departments, and so she had one of the better, or what she felt was the best doctor review my situation, and they conferred with the vascular surgeon there, and we had a session with him. My wife was attending, and he kind of suggested that I could do a bypass, to essentially alleviate the pain. And I kind of asked him, well, how long will this last? If I do this, how long will this last? And he said, well, anywhere from 3 to 5 years. And I didn't really like that answer, because I said, well, what happens after that? And he said, well, you probably have to have, another surgery. And since it was invasive, I also had some other medical friends, doctors. And so they got me a referral into Cedars-Sinai for a second opinion, where I met a Dr. Willis Wagner, who headed up the department over there at that time. And he took a look at, all my tests and x-rays, and he shared it with the rest of the surgeons there in his group. And he, came back, and we had another session, and he said, Steve, I really can't improve the quality of life if we do a bypass for you. I really can't improve what's going on, because your right artery is totally occluded. That right artery in your right leg. And he said, what you can do is start walking, and increase your walking distance, and that will hopefully form collaterals that will bring the blood flow back to both of your legs over time. And so I started doing that, and learned to walk through the pain, and flash forward 10 years later, I'm
Here we
still
are.
doing that. Yeah.
You bring up an interesting point. You got a second opinion pretty quickly, it sounds like. There are a lot of patients out there, and hopefully folks that are listening, that they hear what their physician tells them. They take it as, I've said this before, as gospel, and then they kind of move on. What kind of advice would you give patients that aren't as maybe aggressive, I guess, as you were, that are afraid to ask for a second opinion? It's okay to get a second opinion, right?
Right. Well, I think, when you're dealing with your body, you only have one body. So, it's probably the most important thing you have, right? So in discussions with doctors a long time ago that are friends of mine, we both kind of, they all have suggested to me, you want to do everything you can not to, have any form of surgery if you can avoid it. If you can avoid it, it's something that you have to have surgery for.
Right.
You
Right.
do, right?
Right.
And so, my advice to anybody that has been diagnosed with PAD, before any form of surgery is recommended, that they need to seek a second opinion. And whatever, the cost really, the doctor's visit cost is not that great. And once they've gotten their tests, that they have their tests in hand, and they're able to transfer those and show those to the second, whoever they're getting their second opinion from. I strongly support second opinion. And unfortunately, I belong to some of the groups on Facebook, and the stories there are terrible.
But you bring up a couple of good points. First of all, we know that when we pivot from that conservative treatment plan, which we're going to talk about, to the formal angiogram, looking at the blood vessels with the catheter and possibly an intervention, that kind of starts a clock, meaning, yes, I can put a stent in or we can do a bypass, but it's unlikely that this is going to last you the rest of your life. So you're going to probably need another procedure. And then the time between the first and second procedure and the second and third is going to be shorter. And, you end up sometimes we make folks worse. So you're right on. You have to be very cautious of a physician that's recommending right out of the gate surgery or stents and not trying a conservative program, which is reimbursed by most insurance companies. And you can, just like cardiac rehab, you can do PAD rehab. So tell me a little bit about how you tackled the notion of, okay, I'm gonna walk. I imagine you just didn't go out walking multiple miles a day. It took time to build up. And how did you go about do that? And what'd you say to yourself when you felt like quitting? Because I imagine there were probably days where you just were like, this isn't working.
Well, I'll admit to you, I also had a partner in my walks. I still do, and that I had two Goldens.
Okay. Yep.
Were partners, but now I have one who I have to kind of pull along. She's getting old, but I was also fortunate, again, because I'm a tennis player, and so
Okay.
I was physically active. Again, on the courts, I was in pain. I couldn't do what I used to do, but I knew that if I could, when I started, doing the walking, I could tell that I was improving. So I was still having to stop, and I still have to stop. But I could tell that I could get more distance in. And so actually, I've actually kind of, in some ways, decreased the amount of distance that I'm doing today versus, I built up to, 10 years ago to the, 8 to 7 to 6 years ago, I was probably going further, in the walk. But now these days I do two walks on days that I don't play tennis, and they're for about 40 minutes a walk. But again, I have to stress it's still walking through the pain. I do have pain. So
what do you say to the listener out there that just says I can't walk? Because a lot of my patients, I recommend, for all of them that have claudication, which is what you're describing, that pain when you walk in the calves and in the thighs that gets better when you rest. We recommend a walking program and medications to kind of help. Pletol, Solostazol is one of them. Obviously, we recommend making sure that they're on potentially aspirin, medicine for cholesterol, etc. But I get some that try and they say, I just can't do it. And I think as Americans and those in Western civilization, we kind of want that quick fix, so to speak. But you knew that quick fix was not going to be a long-term fix.
Yeah, I guess what I recommend to them is join one of Kim's groups on Facebook and see, how this disease can progress. And, that to me is really the eye opener. And so, contra to that, understand that, of course, one never knows when I, might start having more severe pain at night. I still wake up some nights with pain in my lower foot. Wakes me up and I have to get up and I walk, to the restroom and then come back to bed and it goes away.
But you have all your piggies, right? You've got all 10.
I have everything. Everything's there. I get a red foot, in the mornings, and my right foot is red when I get into the shower, but after I'm on it for a while, it whitens up. So I can say that to anybody that has been diagnosed and is not in. I'm not saying somebody that has got diabetic ulcers and all the other things that can happen, right? And the severities, but if somebody's been diagnosed with it, and even if the artery is one of the arteries is completely occluded, you can implement a walking regimen and stick with it, and persevere. And I'm proof of that. Now I've also learned that genetically, not all people can grow collaterals. I learned that along the way from a vascular surgeon that I respect. That told me that.
Some are able to grow more than others. You mentioned the importance of the diagnosis, and during each podcast we try to hit on a teaching point here, and I think the teaching point is seeking, like what you did, seeking initial evaluation for your symptoms and not thinking that it's related to something like, oh, I'm just getting old, or my back is bothering me, but there's actually something real going on here. But then also finding the right physician who orders that very simple ABI that's covered by most insurance companies, if not all, with symptoms and risk factors. And as soon as you had that diagnosis, then you were able to kind of move forward. The other thing that I wanted to, before we started recording here, you had mentioned you're an advocate for other patients, and part of the Save My Piggies kind of platform is patients teaching patients. So you mentioned that you've got this walking program down very granular in the sense that which the right socks and the right shoes. Can you share a little bit of that with us?
Sure. I've found that there were certain shoes that I just couldn't walk in. I mean, I really couldn't get any distance at all. And it was, so I was fortunate enough I was up in Sausalito, and I was in a athletic shoe store, and I met the owner there, and I told him, I was having problems with the shoes that I was wearing, and they were running shoes, and he told me, well, you got the wrong shoe. You need Asics. You need to be wearing Asics for the support, and you probably should have orthotics too. And I also knew from playing tennis, my tennis sock had a tremendous amount of cushion. And I also learned that a half sock was better than a full sock because the full sock blocked my circulation to my feet. So I started, wearing the half socks, and so the combination of the cushioning of the sock, the orthotics, and then the ASIC gel canyos, they're the 27s now. They keep changing the shoe, but when you put all of that together, I've got a tremendously cushioned shoe, and it makes all the difference in the world.
It's a matter of, to some degree, trying a different shoe, trying a different sock, as opposed to, hey, I've had these tennis shoes for the last 15 years. I'm trying to walk in them. I can't walk it. I mean, that's kind of simple, right?
Yeah, it is. And, and I think too, I mean, it's, again, just like I was fortunate enough to find, the right vascular surgeon, I was kind of fortunate enough to find, kind of an expert in shoes in an athletic shoe store that, really recommended, not from a, income point of view of what the shoe cost, but, the right shoe for me to be wearing. And, I'm, I'm actually right now, as Kim and I were talking, I'm kind of conversing with somebody in England, taking them through this exercise to see, how she does with the sock, the shoe. So, maybe I'll start, have a couple more test cases and then start recommending it, because it's really worked for me. So
we have to mention Kim, who heads up the Weight on My Heart, and obviously you can follow her on Facebook, and maybe we could put some recommend links to good your recs for the right shoe to wear. If you could go back to maybe before you even had the PAD, your younger self, would you change anything with respect to how you got to where you were? I mean, did you have any bad habits that you probably shouldn't have done that maybe led to the PAD?
Yeah,
if you're comfortable sharing.
No, unfortunately, I was a smoker, and I started smoking when I was about 18. I won't say this in the video, but I was in a school in Switzerland, and the thing to do was start smoking after lunch. So, I got hooked, and tried very hard to quit, and actually went to the hospital kind of course for a week when I was young. And but I learned there that the nicotine addiction, the chemical side of it is 3 days. Mm-hmm. And that kind of stuck with me always. And, the rest of it's psychological. And somewhere, in my 30s, I was fortunate enough to quit. So that, it could have been hereditary, what I have. I mean, my dad did have trouble walking, at my age. So it could be hereditary, but it also could, most likely was, related to smoking, and that's, a mistake.
How often do you get evaluated for progression of the PAD?
That's a good question. I was being evaluated, like every year. And then my physician most recently, I showed you the tests. The last test, I think, was I started to have a little pain, so I went in. But again, his position to me, this is back at Kaiser now. It's a different vascular surgeon, but his position to me was, come back if you're having pain. So he's not doing the annual test right now, because I think he knows that, I put in the regimen, right, and I'm managing it. And if I, for example, if this pain that I am experiencing every once in a while in my foot, if that starts to become a regular thing every night, then we have to look at, something else. But I'm not sure what that something else is. So, at this point in time. So I'm fortunate enough to, continue my routine. I will also say, I'm also fortunate enough. I have for the last 6 years, I've had again, this is not something everybody else can have, but I have a physical trainer who's unbelievable.
Mm-hmm.
And he comes to the house for a half hour, 3 days a week. Monday, the days that I don't play tennis.
Yeah.
And we do a lot of that is stretching and, balance as well as core work. But I think the stretching also definitely helps with this. It's very painful. It can be very painful.
Mm-hmm.
But I think it also helps for the circulation. So
sure. Well, and there's opportunities now with all these, we're obviously stuck in this pandemic. Hopefully we're going to be out of it soon, but the home gyms that are out there, and there's stuff online that people can find for stretching or core work or minimal, aerobic activity within the house. But we do personally recommend walking at least for 20 to 30 minutes, 4 to 5 times a week, just enough to, and I tell my patients the same thing. You walk until it hurts and then you stop. And I often tell them too, to keep a log about how long, their distance, so they see that they're improving, and that helps motivate them as well. What do you do to motivate yourself?
Well, I see my steps.
Mm-hmm.
So I have steps on my phone. And so I think that really always the motivation for me, is, my wife has always told me she's not pushing me around in the wheelchair. So, the motivation for me is to, avoid having to have surgery, for as long as I'm able. You're a cardiologist, so you should also know I blank on it, but I have on my heart main artery, I have a
stent.
No, I have what do they call it?
Aneurysm.
Aneurysm. Yeah, it's 4.6. And it's I've been fortunate enough, again, it has not changed since it was originally diagnosed 12 years ago. So, and that my cardiologist does. I've got a great cardiologist at Kaiser, and she actually works more as kind of like my primary, and she does all the testing. And I do get now with the pandemic, I haven't, but I do get a MRI or a CT like every year or so, every 2 years, so to check that. So I've got that is probably the more major thing that's kind of in the background, but I've been able to somehow manage that too. I could have had that all my life too. Who knows?
Sure. So Steve, my last question for you is, what do you say to that patient who thinks they may have peripheral arterial disease or is avoiding seeking medical attention? What do you tell them to go in and find somebody to get them evaluated, get them screened, get them tested? I think one of the things, as a patient advocate for vascular cures, and, the more and more I become informed in, PAD and this disease, the more important I believe, the earlier screening, the better, and I believe so much in, Ken,
lately has been quoted as, she kind of says, every primary care physician should be checking the pulse as part of, the annual checkup, the pulse in your lower extremities,
Yeah. I had a patient, somebody had asked me, what do you tell a patient who has heart disease about their peripheral arterial disease? Because there's a lot of overlap, and about 15% of people have both. And same thing, I said, make sure whoever is examining you checks your pulses. And
I think early screening, what you're hitting on, I think the earliest that you can screen for it, the better off you are. And the only testament to that, again, is joining one of the Facebook groups and getting an understanding of how this disease can progress.
Right. And
if it's unchecked, I mean,
and that's why we're doing this podcast. We want to raise awareness, and we want to be proactive instead of reactive.
Yeah, no, I have there's a testimonial, there's an 8-minute video testimonial on vascular cures that I did a couple of years ago, and where I talk about, my experience, and I'm actually walking as I'm talking. So my son filmed it, and we're walking in a park. So up in Bend, Oregon. So and I use that, on Facebook. Every once in a while, I'll put that up to kind of support that. A walking regimen can, help you avoid, further complications in PAD. But, as you said, I mean, screening, I think, the more and more, I get involved in this, the more important I see, screening as being. And this, I also mentioned to you that, the work the American Heart Association is doing. I think
we're bringing to the forefront this disease process, and it's
right.
People like you who are helping. You have the disease, you're helping teach other patients, and you're being gracious enough and allowing us to hear your story and hopefully disseminate it. So, Steve, thank you so much for your time.
You're welcome.
My guest today, talking to you. That was a pleasure. My guest today on Save My Piggies is Steve. And Steve, keep walking.
Thank you. Thanks so much. Take care.